everybody, it's Dr. Magnifico from jaredsfullvet.com, and this is Chubby. Chubby's a 3.5-year-old indoor domestic short-haired kitty. He is also 20 pounds. So the average cat is somewhere between 8 and 12 pounds, I would say normally, and he's a 20-pounder. He has always been a big cat. He actually started out as a feral cat, which is why he has a tip on his ear, but he's always been a big cat, hence the name Chubby. They came in today because he was lying around. They hadn't seen him in the litter box, and they were worried that he was constipated. He is constipated, but he is so fat I actually had to take an x-ray to identify that. Constipation in cats is sometimes called obstipation, where they are struggling to defecate and nothing is coming out, so that's getting constipated so much to the point that you actually can't pass any feces. For cats, this happens for primarily a couple of reasons. One, they are indoor, so indoor cats are already sedentary. Two, they are on primarily dry food. Cats that are on primarily dry food have a problem with obesity. Obesity tends to happen more in indoor cats on dry food exclusively, especially if that dry food is of poor quality. So for today, we are going home with a whole new plan for him. He is going to get exercise encouragement. So that's a laser pointer, that's catnip, that's taking his food and scattering across the room so he has to go get it. That's starting to do playing and chasing games. That's really anything that we can do to get him moving. We're also gonna put him on a different diet. So we use primarily Hill Science diet. I'm going to see if I can get her to feed him this and this alone. So very watery, canned food to see if we can get him to lose weight. This is high fiber, so it will help him move the feces better. And then they are gonna have to keep a really close eye on the litter box. For some of the cats that come in that are obstipated, we actually have to start IV fluids and enemas. I don't think, if you've got a cat who's obstipated, I don't think there's any way to get them to pass the feces without IV fluids. Pretty aggressive IV fluids, and then warm water enemas, and then talking about how to manage it long term. For the obstipated cats, typically they're in the hospital for 3 days. So 3 days of IV fluids, trying to manually break down the feces and then get it moving. So for today, he's getting sub-Q fluids, so that's a big pocket of fluids underneath the skin, a diet plan, an exercise plan, and then they are gonna come in every month for us to weigh him to see if we can get him back down to 13, 14 pounds, something a little bit better. I get really worried about 3-year-old cats who are 20 pounds. I mean, 3-year-old is way too young, so it's time to change his diet and change his lifestyle and get him happier and feeling better. The other product that sometimes we talk about is either cat lax, which you can get over the counter, or lactulose, which you can get through your veterinarian to help move the feces. But we are going to get Chubby, not so chubby. So if you look at him from the side and from above, he is just a big fat cat. So we are going to do our best to get him feeling better and looking better. You know, obesity in cats will lead to diabetes, it will lead to cancer, obstipation, constipation. I mean, the joints will break down. I mean, they just are not a species that's meant to be overweight. So if you have any questions about constipation or obstipation, the costs involved with any of that, what you can do at home, how to avoid it, you can find me at pavli.com or here at Jared's Full Vet. Take care, see you later. Bye, Chubsters.